Okay, doctor. How do I deal with the fear of side effects, especially steroid-related immunosuppressive drugs related? For example, like HCQ toxicity, steroid cataract. Doctor, along with this, I have another question. That is an interesting question. How can a lupus patient not turn into a hypochondriac, especially every day one sees a new symptom?
Yeah. Yeah, very true. The first question is
Thank you.
definitely you agree that definitely all of us agree lupus drugs, especially steroids, have lot of side effects. All of us know that. Only way to deal with this thing is have a frank discussion with your doctor. Always when the doctor gives a drug, there will be a risk-benefit ratio. So unless the benefit outweighs the risk, benefit will be higher than the risk, no doctor will prescribe it. For example, in initial days, once you give steroids, you will get Cushing oil facial, you can get diabetes, you can get weight gain, but that is required at that point of time to control your disease and save your life. So always discuss with the doctor what is this and when are I good. And according to now almost 95% of the patients, except there are few patients who require a very low dose of steroids, 90% of the patients you can come down on steroids to less than 5 milligram. So less than 5 milligram of steroid is relatively safer. This doesn't cause as severe disease as serious side effects at 25 milligram or 30 milligram or 40 milligram. So less than 5 milligram is relatively safer. But have a frank chat with the doctor. In chloroquine again is a very safe drug. There are a lot of rumors roaming around in corona era that chloroquine is cardiac toxic, etc., etc. But these are unfounded. Why? Because in what happens in corona is people started taking higher dose, 800 milligram or 1200 milligram of chloroquine, and they develop cardiac toxicities. So in lupus patients, we give 200, maximum 300 or 400 milligram. At those doses, it has been used in millions of patients. It's usually very, very safe in acute setting. Whether toxic, eye toxicity also is a very uncommon side effect of chloroquine. It happens in 1 or 2% after 5 to 6 years. So that also is less. But what the problem usually seen in chloroquine is some people are allergic to it, and some people can develop tanning, darkening of the skin. These are the two issues usually we face with chloroquine. And these things, yes, definitely for young pretty girls and boys, it's an issue. But always chloroquine is one of the best drugs available for lupus. It improves mortality, it decreases the steroid dosage, it's an anti-diabetic, anti-cholesterol. So it's a very, very useful drug. And if possible, always take chloroquine and don't stop it. And second is hypochondria. The problem is living with lupus is a challenge. The only way is if it is lupus related, it will not come down next day, it will progress. If it is just like that symptom, but always if it is severe headache, if there is severe symptom which is troubling you very badly, always contact your healthcare provider and discuss it with them. So they can differentiate it with certain markers, but definitely yes, it's an issue. When you have a minor symptom like what are the main lupus flare-up symptoms? You will have oral ulcers, you will have skin rash, you will have severe headaches, and these are the major symptoms, or you have frothing of urine or high-grade fever. So these are the symptoms usually which comes with the lupus flare-ups, or increase in joint pains. Yes, otherwise usually the other flares, other symptoms like some paresthesia in the bottom of the neck or something, some small things, definitely you can ignore. For example, all the ladies comes to and ask me whether my hair loss is because of flare. It can be because of flare or it can be because of drugs. You can't really differentiate. And those kind of cases, basically, it's a minor, we say, tell the hair loss as a minor symptom. You just observe it, whether what are the other manifestations, other organs, and then decide which way to go. So always discuss with your healthcare provider. Don't turn hypochondriac. And don't keep thinking about lupus. There are better things in life.